So let's just look at what standard, global standard number 12 on staff care says. So it speaks to addressing vicarious trauma and prevention of burnout as an organizational priority for all staff. What are we saying? This is a priority and for all staff.
For us, we have a staff policy on the self-care. In fact, it's one of the major clinical activities that we have in our organization. The actual idea is that if the staff are not taken care of, then the working system becomes challenging. For example, when you talk about vicarious trauma, for example, how that will affect the staff physically, psychologically, but it trickle down to the client as well, because they will not be effective with their work. So in our organization, staff care, in fact, we have a self-care day. Every November 10th is self-care day. In November the 10th, once it's not a holiday, it's a self-care day. I mean, every staff go to the center, you just go, we got food, we just do everything, nothing else, nothing related to work, you just move everything from your head. And then the second part of that is that we have the supervision lines. So we are doing supervision weekly, monthly, right? So the site supervisor is taking over and try to work through with the counselors, again, when there are challenges, and then the local clinicians go in to try to provide support in the way that the staff will be better, so that they are able to manage themselves, so that they are able to work effectively, so that they can, regulate their emotions and be able to be strong. So we have a policy in our organization.
Au niveau du Sénégal, ce que nous on a l'habitude de faire en tant que médecin traitant, on organise des journées de sensibilisation au personnel. Et durant ces journées, on sensibilise les personnels sur les signes d'alerte de la dépression. Par exemple, des problèmes de manque d'appétit, fatigue, irritabilité, difficulté de concentration. Maintenant, le problème qui se pose là, c'est cette prise en charge. Supposons, ça nous arrive, tu sors de la maison bien, tu consultes 2-3 victimes, et en écoutant l'histoire et en examinant le malade avec tout ce qu'il y a comme problème, peut-être la personne s'est fait couper le bras, le pied, ou bien s'est fait violer par plusieurs personnes avec une infection à VIH et tout, tu peux rentrer à la maison déprimé. Et si tu fais ça pendant des mois et des mois, en tant que personnel soignant, tu peux également tomber dans une dépression. Donc, d'où l'important également pour nous de faire très attention, de veiller sur ces signes. Et si on présente ces signes, de se faire consulter également par nos confrères médecins.
Yes, so at CSVR, we have a newly formed wellness committee that looks at improving the existing HR staff support programs that were there. This committee is looking at, a couple of surveys that we sent out for staff to check around their wellness needs, what they suggest, what wellness means to them, how would they like to see wellness in the organization, and then this will be added onto the existing programs. We also have self-care days, but we also have so staff who are in need of maybe counseling services. We have consultants who are able to provide this at no fee to the staff member. We have kind of like a culture of peer support or peer supervision within the department, but also we have external, and at this moment I'm speaking on behalf of the MHPSS team, we have external supervisors as well. It is a requirement also by the councils for us to have supervisors, so we have those. But generally, staff have access to a number of support activities. When days are nice and days are good, we often have a staff self-care budget.
Oui, un peu comme ce que les autres partenaires, les autres organisations ont dit. Il y a un autre élément aussi qu'on peut introduire, c'est les activités ludiques. C'est les activités ludiques qui permettent au personnel un peu de faire autre chose lorsqu'ils sont ensemble comme équipe, autre chose que le travail. On peut se retrouver pour s'amuser, pour avoir un moment de détente. Et ça renforce également la cohésion au sein de l'équipe. Et autre chose aussi, il faudrait que prendre soin des aidants doit vraiment être une volonté politique organisationnelle. Et chez nous, par exemple, ce qu'on fait, en plus des congés, on introduit parfois des jours de repos qui ne sont pas déduits dans les jours de congé parce qu'on comprend qu'il y a parfois de la pression et il faut permettre aux gens de se reposer aussi. Ça doit être une culture de vouloir prendre soin de son personnel ou bien de donner l'opportunité à son personnel de prendre soin de soi.
So we can actually have innovations, new innovations that we come up with that are culturally, contextually appropriate, where the situation at work where, of course, there is a budget, we include that in our proposal writing, process. And of course, we then needed to do something Western. And somebody said, look, I don't want to do that. I want to go to my nganga. What do you call nganga? Witch doctor? Traditional doctor? And they said, look, that's where I benefit more. Okay, you understand what I'm saying? So this person, for their self-care process, they needed counseling from a traditional counselor or traditional healer. What would you say about that? Is that acceptable in your context? Does it work? Yes.
One of the major things to look at in the healing system, the process is what is a belief. Because belief drives people. So I think from our end, we also go along with the belief system we're looking at how much we can get, but again, how strong is your belief in terms of your healing process. So if many clients have said to us, or many people have said to us, yes, I need a sacrifice. Yes, they have to perform the rituals. It is their right to do that. Psychologically, you're not going to be here if you believe that if I don't perform the rituals, I can recover. No. What we need to understand better is how that is going to help you recover. And that is the responsibility we have. But I think to my organization, they have the right to do what they want to do.
Je voudrais revenir sur la question là, de prise en charge du personnel, notamment pour le point et entrer à la supervision médicale ou encore au contrôle médical. Et en principe, ça dépend d'une personne à une autre. Ça dépend également, comme les autres l'ont dit, de croyances d'une personne à une autre. Mais aussi, on ne doit pas oublier de faire référence au texte qui régit l'entreprise. Parce qu'en fait, quand on va au contrôle médical, cela suppose que c'est l'entreprise qui prend en charge tous ces frais-là. Alors, je me pose la question de savoir, si on va chez les nganga, on va chez les féticheurs, et qu'on a mené à l'entreprise une facture, est-ce que l'entreprise va payer ça ou pas? Il y a des lois au pays qui disent que non, on ne tient pas compte de ce que disent les féticheurs.
Exactly. I think at a personal level, we do have destructive and constructive ways of looking after ourselves. And what we are talking about here are those that are constructive, those that are helpful. Because this is a tricky question that I've just asked. It's about our wellness. So it really depends on the organization and the motive behind doing that. So yes, it can be self-care, can be culturally, contextually appropriate, but also based on the intention.